Hi, welcome to Money Confidence. I'm Crystal Ockley. I'm the Chief Financial Strategist here at Confidence Wealth. And every week I try to bring a topic that's important that we are talking about in meetings and see how I can be of help to you. So one of the topics that's definitely been on all my clients' minds at every meeting I've had is really healthcare and the cost of that during retirement. And it is very interesting because, we always plan for everything else in retirement, whether we're looking at vacations and luxuries and things we want to do. But healthcare is something that maybe we're not looking at, and the cost of that is very important. According to statistic now, a couple spends about $270,000 on their healthcare during their retirement. Now, keep in mind, this is not catastrophic. This is just premiums, doctor visits, simple things that really accounts during their lifetime in retirement about $270,000. So single, just think of 130 or 140,000. With that said, these are the things that are very important that you have to think about when it comes to healthcare costs. How do I plan for it? And then also, how do I make sure that I'm mitigating these expenses, or I'm being very smart about it? Because there are a lot of these myth that you think Medicare is going to take care of everything, where it's not really true. There are certain things Medicare takes care of, and there are certain things you got to make sure you have supplemental and so forth plans for. And then not to mention, obviously, if there is anything catastrophic, such as long-term care, chronic, or anything that happens that's going to go where you can't do 2 out of 6 daily activities, and now you have to have some care, whether it's on short-term for recovery or long-term. Medicare covers very little of that, if any, and that's just to get you, in a sense, when you're in the hospital, say, for example, and something has occurred, Medicare may be covering you for a certain point, but after that, it becomes what's called long-term care, because the care is going to be for more on long-term, and that's what Medicare no longer covers. So we have to really take a look at it holistic and look at your entire situation and make sure, do you have everything in place to take care of all of your health care in retirement? So you have to account for not just your premiums and all those payments, but looking at also supplemental care and making sure that if you do have, drugs that you are using, to make sure you're taking care of. Of course, I'm talking about prescription drugs and so forth that you want to be taken care of and so forth. And then do you have a supplemental plan? Do you have Medicare Part D, or have you got Medicare Advantage to take care of all that? And then how is this all going to look all together? I just want to make sure that we don't take health care costs in a sense as a back burner and don't think about it, because it really is something that can just get higher and higher in retirement. One of the things to always account for is sometimes I have people that say to me, well, you know what? I am not going to spend that much traveling when I get older. Should I take that travel cost out? And I always say, no, just keep it in there during the planning process, because that may get replaced with things such as, let's say you're in your 80s. Maybe you were doing your own gardening. Maybe you were doing your own housekeeping, but maybe now you don't and can't do it. So you need more of those types of help. So it's not true medical costs, but it is because you're slowing down and you're going to need more help. I have a client that in her 80s is just tough for her at this point to do even her own laundry. She's living by herself. She's 85. She has arthritis. So she needs someone that's going to come over and do the laundry and fold it, change the bed and, do the things that it's tough for her hands on to be. So that's a cost. It's due to medical in a sense, but it's not a medical cost because of the fact that it's not like insurance is going to cover the extra housekeeping charges. So these are the things that are really important to take a look at. And then also making sure that what are the things I can do? What tips, can I give you to help you possibly lower the cost on some of these things? So that's one of the reasons I decided to actually hold a webinar on this and go over healthcare costs, medical versus long-term care, the combination of both, things that you can do to make sure that, you're doing your best to be proactive to keep the cost lower during these periods, or at the very least have a plan in place to be prepared. So with that said, if you're interested and you want to have access to that webinar, please go ahead and let me know and I'll send it to you. If you're already on my list, you're going to get the invitation, so no worries about it. And I would love to hear some of your stories of what are the things that you've been hearing about, and maybe families that you had experience with, whether it was your mom, your sister, things they went through. What are the things that came up that were very costly during their retirement when it came to medical costs, and how did your family handle it? I would love to hear some of those shares and just find out what things your family did, and then what are you doing yourself to make sure you have a better plan in place. So until next time, looking forward to seeing you soon, and keep an eye on for that webinar. Have a good one.